Welcome to the Ghanaian Doctor. Like, share, and subscribe. Thank you.
A wonderful evening to you all. Dr. Samuel here, and today I would like us to discuss a very critical topic. I want us to discuss menopause. Menopause. I used to think that menopause was actually from the English words men and pause, trying to tell men to stop bothering their wives with babies, because during menopause, there's no more menstruation. So women don't have to or are not able to give birth. So during that period, the wise man decided to name it men. Stop bothering women about childbirth and all that. That's just by the way. Menopause comes from Latin words meaning men, month, and pauses, cessation. So basically, cessation of the monthly flow or cessation of the monthly menstrual flow. Based on this, menopause is defined as when your monthly menstrual flow ceases for 12 consecutive months. So if it is less than 12 consecutive months, we do not define it as menopause. It has to be up to 12 consecutive months. And there shouldn't be any other thing that's accounted for the cessation of flow. Some other things that could account for the cessation of flow include surgery, where the ovaries are removed, or sometimes chemotherapy or radiation therapy for certain cancers or medical conditions, and sometimes with certain genetic disorders can lead to cessation of menstruation before its natural time. The natural time for cessation of menstruation is 47 to 52 years, even though some may extend it and say from 45 to 55 years. If a woman sees her menstruation end before 45 years, but is after 40, we call it early menopause. However, if it is before 40 years, then it's premature menopause. If you're a lady listening to this video and you realize that your menses have stopped for 12 consecutive months while you are yet to be 40, to be a good idea to investigate and find out if there's probably a genetic component to it, or probably some medications you are taking that is contributing to this. All right, so let's go a bit into the concept of menopause. During menopause, the ovaries stops producing eggs every single month. The second thing that happens too is that estrogen, a hormone which is needed to maintain normal function in women, starts coming down. The effect of a reducing estrogen is that there is an increasing risk of heart disease or general cardiovascular risk for women. That's the first thing. There's increasing risk of bone disease, or what we commonly call osteoporosis, which makes the bones of women weaker than usual. There is an increased dryness of the vaginal area, which can lead to bleeding during sex and painful sex. There is also weight gain, where the woman usually gains weight without knowing exactly what is leading to this particular gain in weight. Finally, there is a risk of infections both in the vaginal area and also in the urinary tract, or where we wee through. So these are the kind of factors that could happen uh, during or as a result of menopause. Now let's discuss what are the things that we see that could communicate to us that menopause is here or menopause is about to come. About 8 years to 10 years, or in some women, maybe shorter, women start to notice certain changes that communicate that their menopause is about to arrive. We call this period the perimenopause period. Now, during the perimenopause period, women usually see a number of things, including hot flashes, including dryness of the vagina, including irritability, mood swings, mood changes. So when you see these things, it's a herald of what is coming. Usually during the 12-month period, at least, when menses has ceased, these symptoms can continue to be present or even increase up till after menopause. In some women, the symptoms resolve by themselves without any sequelae. In other women, unfortunately, they continue and they remain. It can also come with attention issues and memory issues, where you forget things you usually could remember quite easily, and you usually lose focus compared to how you were before. Now, considering the skin changes, it can come with hair loss or increased hair. So increased hair is something we call hirsutism, where there could be facial hair on the woman, there could be some hair, beard hair, or basically increased hair compared to before, or there could be hair loss as well. Apart from that, we can also notice a drying of the skin compared to how it was before. Finally, there could be increased sweating in the night associated with increased because something hot flashes, where you easily feel that the temperature of the room is higher than usual. So most women will have to resort to wearing loose clothes or clothes that make them more comfortable, because if they wear normal clothes, they feel that the temperature of the room is a bit high. Another solution is also to use a fan, a handheld fan, which you can use as and when you need. Let's look at the vaginal symptoms. It can come with vaginal dryness, which can present with difficulty or painful sexual intercourse, can result in a reduction in libido or sex drive, and interestingly, some individuals actually have an increased sex drive. So if your sex drive increases after menopause, it's something that we can see, and does not mean that there is anything abnormal. Another thing that can happen is that there can be something we call prolapse, where the womb can come out through the vaginal space. This is usually happening because the support the estrogen has for the womb goes down. So sometimes you can have something we call prolapse, or the womb comes down through the vaginal space. In addition to prolapse, there could also be something we call incontinence, where the woman urinates when she does not plan on urinating because of the same reason. So I've gone through some of the typical symptoms and signs we see during menopause. Now, how do we manage, or how do we solve our problems? I think this is the reason why most of us are watching this video. The first one is dietary changes, the food we eat. Eating certain foods like soy, chickpeas, vegetables, fruits help to manage the estrogen levels, and this can help the woman feel better or feel good. Exercise also helps to improve the hormonal balances. So exercising about 150 minutes a week, which is usually 3 times a week, walking for 30 minutes, brisk walking, is usually good enough exercise for that age range. Another thing that we can do is, for individuals with dry skin, you can get some moisturizers to be applying on your skin, which will help to keep your skin moist. If there's vaginal dryness, lubricants are available to help to make you feel more comfortable. Now, in addition to all this, there are also hormonal medications available, which will replace the estrogen of the individual. It is, however, not recommended that these hormonal medications be started without seeing a medical professional. This is because the hormonal medications have side effects which are best prevented when they are given in particular formulations. Kindly see your medical professional before you start any hormonal medications. Before I wrap up, I would like to mention that men also have a form of menopause which we call andropause. In andropause, basically the testosterone level reduces gradually. However, in men, it is not very clear like it is in women. This is because the testosterone level usually decreases by 1% every year compared to the relatively sharp decline in estrogen that is seen in women. All right, all too soon, I've come to the end of this discussion. I hope you learned something. This is Dr. Samuel, your Ghanaian doctor. I hope I've given you a perspective of menopause from the Ghanaian doctor's perspective. Thank you and take care. Bye.